Hello friends, welcome back to my YouTube channel. And as promised, way back, I promised to deliver a video regarding my review of using PROLUX LUMADENT Dental Light System. So basically this is the video. If you are wondering, and if you are still considering whether to get the light system, just buy it. No matter what system you buy, you won't regret it. Trust me. So basically that is the end of the video. Okay, no, I'm just joking. Okay, today I'm going to give you my thought process and also my feedback regarding getting a specialized light system, light solution for you to use in your practice. If you are not still convinced, do watch until the end, whereby I will elaborate more on my thought process, my feedbacks, and I will basically make a case for you to use a dental light dedicated system. Number one, it helps with ergonomics. One of the main ergonomic factor is people who are not using any specific dental light system usually depends on their dental chair light system. So what happens when you use a dental light system or dental chair light system, it's not sufficient, lighting is not sufficient, and this will result you to actually bend and look more downwards to look and get a better vision. So with a dedicated light system, you can actually have better light quality, light intensity, so that it will illuminate your field of view, so that you don't need to bend so much to look, and it's one of the ergonomic benefits. Number two, no more shadow. What does it mean by this? Basically, when you have a dedicated light solution that is mounted either to your loop or your headgear or whatever it is, basically when you have a light source that is coaxial to your vision, what happens is that the light will have less shadow. Why? Because when you have a light source that is reflecting from a dental chair light, you need to angulate it properly so that you can have a better light and with less shadow. With a dedicated dental light solution, you will have no shadow as long as the light is coaxial to your vision. Previously, in my experience, even with loop, without proper light solution, light attachment, I depend on my dental chair light. So it's very annoying, especially when you are doing scaling or checkup. You need to have a very good assistant to actually predict which area that you want to have it illuminated. So it means that your assistant will be continually shifting the light source so that it will illuminate the field of view that you are working with. And to eliminate the shadow is very difficult, especially for scaling, whereby when you tilt the patient head and then the working view is already off. So the assistant needs to shift again. It's very tiresome, it's very annoying. With a dedicated dental light solution, I do not need to worry at all, and my assistant don't need to reach out to the dental chair to correct the angulation, because when I just look, the light follows my vision, and you can't ever go back to using dental chair light. Number three, better restorative control. For most of dental light solution, they have built-in composite filter unit, which you can use or not depending on your usage, and it's very easy. Unlike many dental chair units, they don't have this feature. I don't think there is any specialized or specific brand that actually have a dedicated light filter in their dental chair. So usually at most what happens is that the chair will dim the light source so that it will reduce the possibility of the light accidentally curing your composite. This is going to have two issues. Number one, because of the intensity is less, meaning you will be squinting and forcing to look properly to have sufficient lighting so that you can work with your composite. And number two, it's not really a solution, means it will eventually cure your composite, especially if you are really taking your time carving the morphology. And this is the reason why I really believe that the only solution, if you want to do good restorative dentistry, you need to have a dedicated light solution, be it in the form of mounted to your loop or headgear or Dr. Skin's light. Basically, there are four considerations for me that lead me to finally get PROLUX. Number one, there is the light intensity. Number two is the battery life. Number three is convenient. And number four is cost. So basically, when I want to buy it, I'm actually considering whether to get Airlux or actually to get a PROLUX. So that is the main consideration, because for me, I don't really feel Unilux will fulfill my criteria and my needs. Might as well I get something that is big and pack more power, or something that really frees me, give me the freedom working without wires. Okay, when I want to buy it, my first thought process is that I need to find something that can actually illuminate and have sufficient lighting while I'm trying to do endo. And for the time being, Airlux, as far as what I understand, does not have the highest setting as per allowed by PROLUX due to battery conservation feature. And this is why I consider this factor, because I want to have the highest illumination when I'm doing my endo. For most of the time, I use maybe the first or second level of brightness and it's enough. But for endo, especially the molar endo, I want something to have, I want to have a better illumination, to see better, to see more, to see better. Number two is regarding battery life. For me, I wanted to have something that can last me throughout my days. With Airlux, sometimes you can, sometimes you don't. It really depends on how you use it and the intensity that you use throughout your day. With PROLUX, I can get by one day with no issue, and this pack so far have been serving me for the last 6 months. One battery pack can actually serve me on one single charge for about 5 to 7 days, sometimes more, up to 10 days. So for me, it reflects on the third part, that is the convenience, meaning I do not need to remember to charge it at the end of the day. Meaning it's quite liberating, meaning you don't need to continuously monitor, see the battery indicator, charge it. Of course, you have this indicator, as you can see, D60 indicator. It will help you to gauge how much power you still have. But for me, that is the convenience, because I don't need to remember to charge it at the end of the day. Unlike if I use Airlux, I would probably need to charge it at the end of the day, every day. Okay. Number 4 is the cost. Of course, when I consider the cost, I feel that in the end of the day, you need to have two battery pack, either the Airlux or the PROLUX. So after calculating the cost, I feel that I won't mind so much having this pack in my pocket. It's quite acceptable, although it's slightly on the higher width or the thicker width side. It's slightly bulky, but at times I actually forgot that it's even there. I bring it to my home, back home, while it's still in my pocket. Why? Because it has this hook, whereby when it is hooked to the pocket, you don't actually feel the weight at all. And it's not really bulky, and you don't have any sharp edges, so it's really comfortable in that sense. Now, if I really want to nitpick on the small things, yes, it's going to be slightly inconvenience. Why? Although it's convenience in the sense that I do not need to remember to charge it every day at the end of the day. But of course, when you have a wired system, you need to plug the wire all the time. And you need to remember to make sure that the contact is okay. With the current norm now, we must wear PPE all the time. Of course, previously, it's not so much of a hassle. For checkup, for basic checkup, it's not really compulsory to wear PPE. But now, you need to protect yourself. And this is, for me, the biggest downside of using white system. Meaning, I will spend 1 minute at most trying to, number 1, to wear it, okay, to tighten the loop. Number 2, to thread the wire inside the PPE. The gown, the PPE gown, and then to plug it in the battery pack. So basically, that is the biggest downside with wired solution. Of course, you can counteract it with having wireless solution, but for me, I don't feel that as a deal breaker. For some, yes, you might feel it as a deal breaker. Okay, now the question. Some people worried that having wired solution, you will tangle up everywhere, to the dental chair, to the patient clothing. But so far in my experience, that is not the case. Because when you wear gown and you thread the wire inside your gown and the pocket sitting in your pocket, I don't find any issue. I don't feel it is an issue, and it hasn't happened to me. I love it because it's very easy. I can change the light intensity setting from here. I can actually tap it with my arm when I'm wearing it. It's very easy. Okay, I can tap it there, tap it there. If I'm wearing glove, I can tap it there. If my glove is really dirty, I can ask my assistant to actually on/off cycle to setting for me, and it's very easy. Even after 6 or 8 hours of continuous use, the battery pack is very cool to the touch. It's not even warm, it's not hot. So I don't think that is an issue. Number 2, even with using it for example 2 hours, 3 hours, I don't really feel any heat or warm from the light. So I feel it's quite comfortable in that sense. So you don't need to worry about having a very hot battery pack in your pocket, or hot or warm temperature hanging near your face. So for me, I don't find any issue. Okay, so that wraps up my review. Do drop a question below, and I will be more than happy to actually entertain and answer any question or concern that you might have. Okay guys, see you again.